People suffering from sciatica will most often be exposed to treatments that are provided by their doctors and other healthcare practitioners first, such as medication, spinal injections, physical therapy, surgery, and occasionally new methods of treatment such as spinal decompression. While each of these methods definitely has its place in the treatment of sciatica, and many people get benefit from any and all of these methods of treatment, none of them can really be considered a permanent cure for sciatica. Self-treatment and ongoing management of the underlying causes of sciatica is not only possible, but is absolutely necessary to recover as quickly as possible from sciatica, keep it from returning, and keep it from getting worse over time. Even people who have had surgery must engage in some kind of ongoing self-treatment management of their condition or risk developing sciatica, back pain, and other symptoms again. Many cases of sciatica are due at least in part to disc bulging and/or degeneration. Surgery may actually remove part or all of a damaged disc, which places additional stress on nearby discs, often resulting in other discs bulging or degenerating years after surgery. With or without having surgery, it is very important to use preventive treatments on an ongoing basis to prevent the progression of disc bulging and degeneration. Let's take a look at what happens with disc degeneration. Let's look at some of the changes that can occur in the spine. In a normal spine, we'll see a nice thick disc, both above and below the vertebra, and the edges of the bones are nice and smooth. With the early stages of degeneration, the disc gets a little bit thinner as compared to the normal, and we still have normal margins on the bones without any particular ridging. As degeneration advances, the disc gets even thinner, and now we start to see a much thinner disc, plus we're getting some rigid, kind of jagged edges on the bone that is a sign of the bone starting to grow together with the other bones. Notice as it compares to that smooth margin on the normal. And then in late degeneration, the disc is almost gone, and the bone edges are actually growing together. It's fusing to be one piece of solid bone. There's no longer much disc, and it actually becomes a solid piece. Fortunately, sciatica can usually be relieved and prevented with exercises and other home treatments. Simple, low-impact exercise like walking, whether it's outside or on a treadmill or elliptical trainer, can go a long way to improving circulation to the spine, reducing swelling, and just keeping the general structural muscles around the spine toned and fit. Stretching exercises, such as for the piriformis muscle as shown here, can alleviate sciatica symptoms that are generated by muscle tightness and knots known as trigger points, which are commonly seen in the piriformis and gluteus minimus muscles. It can also reduce pressure on the sciatic nerve from the piriformis muscle and reduce pressure and tension on muscles in the lower back and buttock area that can indirectly cause sciatica. Physical therapy and chiropractic techniques such as the McKenzie method shown here can be adapted for self-treatment at home and can be used to not only alleviate sciatica very quickly, but also prevent it from returning. Additional exercises, cold and hot packs, acupressure, various positioning tricks, and even emotional release methods can also be used as a method of controlling sciatica symptoms at home and preventing the underlying causes for sciatica from becoming worse. But the first step to finding the right treatment for you is to try to determine the cause of your particular symptoms. To learn how to do that and to get a free ebook to help you begin treating your sciatica right away, please visit www.sciaticatreatmentathome.com. I hope you found this video helpful, and if you have any questions or comments, please leave them in the comments section below. Thank you for watching.